This was a 70 years male patient present to us with the history of urinary retention. On ultrasound, we can see there was a large prostate gland, and there is a calculus which is also present, and along with there is a thickening of the urinary bladder wall, and there was a focal thickening which was limited to the right lateral wall of the urinary bladder. Considering the age of the patient, the first diagnosis was the mass of urinary bladder wall, and the most common mass in the urinary bladder is the transitional cell carcinoma. These cancers are usually superficial, and 70 to 80% are the papillary type. Although ultrasound has limited role in the diagnosis of transitional cell carcinomas, however, the ultrasound is easily available in the outdoor for the first most diagnostic tool. Conventional urography or the cystogram is still important valuable tool for the diagnosis. In this image we can see there is a mass lesion in the form of filling defect, while the contrast is filling the urinary bladder. Next very important tool is the CT scan, and these are still the best diagnostic tool for the detection of the urinary bladder masses. In this image we can see a mass lesion which is present at the base of the urinary bladder. CT scan is also important to rule out its extensions beyond the walls of the urinary bladder, as well as for its extension to the other viscera, and for the metastatic workup. MRI is the still best diagnostic tool for the detection of the stage 1 to 2 and the extension of the lesion into the urinary bladder wall and beyond the wall of the urinary bladder into the surrounding fat and viscera. Now come to the treatment options. If the tumor is superficial and limited to the wall, then the local surgical resection is the best technique. But if the tumors are invasive and infiltrated to the surrounding viscera, then the massive surgery is performed in the form of cystectomy, along with chemotherapy and the radiotherapy. So for the every patient which come to us with the urinary retention and the hematuria, first diagnostic tool is the ultrasound, and then through the various diagnostic procedures like the CT scan and MRI, along with the biopsy. If the diagnosis is made, and then the treatment options are according to the stage of the lesion. Thank you for watching.